This Wuhan wet market is where experts believe it all began in early December 2019. Dozens had fallen ill from what Chinese officials were calling an outbreak of viral pneumonia. Authorities assured the public that the virus wasn't contagious.
China and WHO was saying there's no evidence that there's a human-to-human transmission. In fact, we were sort of appalled because it was so clear that this was transmitting from human to human.
It wasn't until over a month later, on January 23rd, that Wuhan went into lockdown. A new report by an independent panel says the containment measures came too late. The Swiss-based Independent Panel for Pandemic Preparedness and Response says by the time the lockdown came, COVID-19 had already spread to Japan, South Korea, Thailand, and the U.S. But Beijing has defended its pandemic response.
As the first country to sound the alarm against the pandemic, we took prompt and decisive measures, even though we had incomplete information at the time.
The panel, chaired by former New Zealand Prime Minister Helen Clark and former Liberian President Ellen Johnson Sirleaf, also criticized the WHO for delays in sounding the alarm. It's called for reforms to the WHO, which took more than a month to convene an emergency meeting on the pandemic in January 2020, then waited until January 30th before declaring a global emergency. The panel didn't only lay blame on the WHO. It also said public health officials worldwide failed to move quickly and decisively, a mistake country after country repeated throughout 2020.
That led to a massive spread in the world, and I think the world didn't also pay as much attention as they should have. In fact, I think January 30th, if I remember correctly, it was the time when the WHO started to say that this is something serious.
Looking ahead, the panel highlighted inequality in the world's vaccine rollout. Rich countries like the U.S. are expected to finish their campaigns by year-end, but poorer countries are unlikely to have even vaccinated their vulnerable by then. Their rollouts are expected to continue until the end of 2023.
More than 39 million doses of vaccine have now been administered in at least 49 higher-income countries. Just 25 doses have been given in one lowest income country. Not 25 million, not 25,000, just 25.
The WHO has called the disparity a catastrophic moral failure, that the young and healthy in richer nations are getting shots before the vulnerable in poorer countries. Natasha Hussain, TRT World.